Now, among payers that are distracting your doctor from you, government is far out in the lead and truly sets the pace for everyone. Through the entitlement programs, mainly Medicare and Medicaid, government typically carries the largest population of covered patients in any given area. Government agencies lay on providers the most burdensome and complicated and costly requirements by far. Doctors and hospitals cannot afford and really don't want to reject all patients in their service areas that are covered by the entitlement programs, so they end up organizing their delivery systems and methods around the most onerous requirements to which they are subject by payers, that is, the government's requirements. Insurance companies fall in line with the entitlement programs because there is little pressure from providers to do differently. Doctors and hospitals are already resigned to following the government's rules. Additionally, as the government programs cut reimbursement in an effort to reduce their expenses, doctors and hospitals are obliged to depend more and more on private payers to take up the slack, so they can hardly afford to be picky over the private payers' rules and requirements. There are many other government activities that interfere with healthcare delivery. One of them is that government limits limits competition amongst insurers. This protects companies and insulates the states from one another, so they don't have to deal with the unpleasant business aspects of competition, but it promotes poor quality products and poor service and higher costs. This also prevents portability. If you decide to move from California to North Carolina, you typically have to drop your health insurance policy and buy a new one when you get there. Another way that government gets involved and interferes is through the licensing of providers. Now, this is typically a state government function. This affects not only healthcare professionals, but also hospitals and other facilities, and it's ostensibly done to maintain quality and distribution of services. There certainly is a positive role in this respect, but frequently the rules are overly restrictive and politically influenced, and that unnecessarily limits choice and competition amongst providers. Government also allows and frankly encourages astronomical awards in malpractice suits. Malpractice lawsuits are worthwhile and important. It's important to have consequences for medical malpractice, and victims deserve to have compensation when they're harmed. However, the lack of restraint by our legal system leads to an irresistible temptation for abuse. And this is compounded by the fact that much of the awarded money goes to plaintiffs' lawyers rather than to the patients who are actually harmed. The expectation of perfection in performance by human beings is unreasonable. Medical professionals and facilities should definitely uphold a high standard in their work, but they are not gods, and they shouldn't be blasted to financial oblivion for mistakes that they made. When we choose to trust a medical provider, we must accept some risk due to human fallibility. We all pay a high price, though, for malpractice insurance and defensive medicine that arises out of our current unbalanced legal environment. There are many ways in which government interferes with our pursuit of health and healthcare. Unfortunately, our current federal leadership is recommending more of the same. Legislation that's currently under consideration does not reduce interference of the government in medical care and medical decision making, but it increases it. It enlarges and expands the entitlement programs in their current forms. It anticipates savings from Medicare cuts, but these will likely manifest as further cuts in provider reimbursements if they are realized at all. This legislation will cause multiple adverse effects in the area of private insurance. First of all, this legislation would institute mandatory insurance. This will require everyone to purchase insurance of a certain minimum coverage, which will further limit competition amongst insurance companies by restricting the range of products that they can offer. The legislation requires insurance companies to provide coverage despite a patient's pre-existing conditions, which will necessarily raise medical insurance costs for all of us, and will also further reduce the range for competition between the insurance companies. It institutes rules to prohibit rate increases by insurance companies, a new addition. These provisions will make insurance companies private in name only. What decisions would really remain for the insurance companies to make for themselves? They would be told by government, everyone has to buy coverage. You have to accept anyone who applies for a policy, This is what you can offer, and this is what you must charge. The only real decision left for the insurance companies is whether or not to stay in the health insurance business at all. Insurance exchanges are supposed to be formed by this legislation to promote competition. But with all these other restrictions that are being placed, it's unlikely that there will be any significant competition amongst insurance companies in these exchanges. I would summarize by saying at this point, it appears that the government is much more a malefactor than a benefactor in this business of healthcare in our country, standing between you and your doctor, and frankly, standing between you and your health. What do we want and need? Now, we need a healthcare delivery system in which providers, and by that I mean your doctor, your hospital, pharmaceutical companies, medical device manufacturers, and other providers of healthcare, where they work for you and not for an outside payer. This would increase accountability to you and to your needs. And under these conditions, quality of care would go up and costs would go down. We need an insurance industry which provides products which are tailored to the needs and preferences of customers. Now, achieving this requires that they be released to compete with each other fully for your business. This would drive them to work with you and your doctor and other providers to facilitate high-quality care at lower costs. We need a government which takes a very limited role in this whole process. We need our government to facilitate these other goals, mainly at the state level, by gathering and publishing information about the quality of care delivered by providers so we can better choose whom we wish to hire for medical services. We need the government to remove roadblocks that exist to competition amongst providers and insurance companies. And we need our government to play its usual role of punishing abusive and unlawful practices by providers toward patients, by insurers toward customers, and by businesses toward competitors. We also want our government to distribute funds for medical care to those in need. That's something that we've always desired to accomplish with all of this. But these funds need to be given directly, with no conditions other than they be used for medical care. This distribution has to be done according to a consensus and according to a budget. Finally, we want and need our people to take back personal responsibility for their personal health, with gratitude that we live in a free and generous society, rejecting the dependency which we have encouraged and which is toxic to ourselves and to our nation. Thank you for listening, and thank you for thinking about this subject, and thank you for speaking up, especially with your vote.